Hello, everybody, and welcome back for our second panel today, which is titled In Sickness and in Health, Regional Health Security. Before we get started, for those of you that weren't here previously, let me go over two quick administrative notes. For those of you that are interested in hearing the presentation in Spanish, we do have simultaneous interpretation. All you have to do is go to the bottom right hand of the screen. There should be a global icon and just hit that. If you're on your cell phone, if you hit more, then it should show the interpretation icon, which shows like a globe. Para los que están recién en participando por primera vez hoy día, sí estamos ofreciendo interpretación simultánea. Lo único que uno tiene que hacer es apretar el botón que parece como un icono, que parece como un globo en la parte inferior a la derecha de la pantalla. Si están en su teléfono, tienen que apretar el botón que dice More y eso te lleva al icono del globo para convertir el idioma a español. We're also, the last administrative note is that we're also offering a Q&A chat window for everyone to please, ask their questions or make comments during the panel. We encourage that you add your name and your organization when asking, so that way we have a better context who's asking the question. Okay, so let's go ahead and get started with a panel. And just a quick overview. As I mentioned before in my opening comments, we're trying to take a broad look at Latin America and its kind of role in the global context over the next several years, decades. But to be able to do so, it's impossible for us to take that look without actually taking the time at looking at what the most pressing concern really is in the region, which is COVID-19. And unfortunately, COVID-19 pandemic has highlighted some systemic problems within the region. As Dr. Paul Angelo had said and mentioned in the previous panel, Latin America houses 8% of the global population, but accounts for 20% of deaths from COVID so far. It also highlights weaknesses in the healthcare system, and then also the region and each of the countries, what I call global negotiating power. And you can see this in its attempts to be able to receive the vaccine. It's unknown how long it'll take before the region gets the vaccine. And, as Dr. Cynthia McClintock, when she discussed Peru in the last panel, mentioned, she was saying even Peru has been able to negotiate some vaccines from China, but even that's riddled with corruption and highlights even some of the corruption that's emerging or has always existed to some degree in Peru. But while COVID is an immediate priority, I think it also highlights a longer-term problem in terms of overall health security throughout the region. Other viruses have emerged in the region, such as Zika, but there's also a very large likelihood that new undiscovered viruses will emerge as well. And so really the overall long-term question is whether these issues have the potential of holding back the region, much the same way as the debt crisis did during the last decade of the 80s. So today we have two great panelists that are joining us to answer this and really expand on the issue of regional health security today. So first we have Dr. Monica de Bolle. She's a senior fellow at the Peterson Institute for International Economics. She's also an adjunct lecturer and a former director of the Latin American Studies and Emerging Markets program at SAIS at Johns Hopkins School of Advanced International Studies. And then we also have Dr. Ciro Ugarte, who's the Director of Health Emergencies at the Pan American Health Organization for over 4 years now, and has overall 22 years of experience working at the Pan American Health Organization. Before his current position, he worked as the Director of Emergency Preparedness and Disaster Relief. So to start off this panel, I'm going to give Dr. Monica de Bolle an opportunity to give her comments. Each panelist will have about 15 or so minutes to provide their initial remarks, and then we'll move on to a Q&A session, which will take us to the end of our time. So please, Dr. de Bolle, thank you very much for joining us, and please share with us your thoughts.
Thank you, Jim. Thanks very much. Hi, Dr. Ugarte. It's a pleasure to be on the panel with you. And it's indeed a pleasure for me to be here participating in the Security Forum, which has become something that we do every year in the Latin American Studies program. So let me start off by talking about the situation overall, because to sort of understand the trends in Latin America, where the region's going, what is happening, we have to first understand the context of the pandemic in the region and how it has been playing out for a year now. Actually, today marks 1 year that the pandemic arrived in Brazil, specifically. Of course, around this time, it also arrived in many other countries in the region. So it is a particularly, in a sense, tragic but opportune day to have this discussion. The pandemic had, so if we look at country responses in different parts of the region, they were varied. No country had the same response. Some countries were better able to put non-pharmacological interventions in place, or in other words, stricter sanitary measures, lockdowns, quarantines. Some countries were also fairly successful at contact tracing initially, and that helped, at least in the early days, to dampen down and to sort of buy time for at least a while. Other countries were not as successful. Actually, other countries failed miserably. Brazil is one such country. Mexico is another such country. And that was, there were many factors involved in that. But one major factor, of course, was the leadership of these two countries, which both, in this case, Jair Bolsonaro in Brazil and Andrés Manuel López Obrador in Mexico, failed to convey the correct sense of urgency, this is putting it mildly, as to what we were facing, what the world was facing, what the region was facing, what this virus meant. Bolsonaro famously said that the virus was just a little flu, the illness that it caused was just a little flu, that there was nothing to worry about. This was after having observed and us having seen what was happening to European countries, particularly the very tragic and humanitarian crisis in Italy and also in Spain in the early days. But the fact is that the illness and the virus were played down quite significantly. There were also a lot of attempts at stopping governors from different localities in Brazil. The same happened in Mexico, from doing the sort of strict lockdown and quarantine measures that were necessary, because the overarching view, and that actually played out in a lot of different countries in the end, was that the health concerns and the concerns over the economy were contradictory. So in other words, the health concerns and the lockdowns and the quarantines were going to do serious damage to the economy, and therefore there was, sort of a trade-off to be played with. And that viewpoint of an unexisting trade-off between health, public health, and economics, that drove policies to a large extent. Policies both on the health front as well as on the economic front. And as a result, many of as a result, for the region overall, with of course differences amongst different countries, the response was broadly dismal, which meant that we are now at a point in the region where the pandemic is still raging. There are places where the hospital systems are again collapsing, just as they did initially. And in particular, there are novel variants of the virus, the so-called variants of concern, that are circulating widely in the region, some of which actually appeared in the region. So two such variants of concern, and this is just to inform our viewers what that means, what our participants, what are variants of concern. Variants of concern are those variants of the virus that accumulate mutations that are perceived as being dangerous in some sense, either because they turn the virus more transmissible or because they turn the virus more capable of evading our immune responses, or both. And two such variants of concerns, I'll call them VOCs for short, two such variants of concern, VOCs, arose precisely in Brazil, one of them in Rio, it was called P2, and the other one in the city of Manaus, it was called P1. So P2 and P1 are now in wide circulation throughout Latin America, as is the VOC that appeared in the UK. All of these VOCs appeared in late 2020. The VOC that appeared in the UK in late 2020, called B.1.1.7, that particular VOC is also circulating widely in Latin America. We do not have the adequate capacity, with the exception of a few countries, to trace where exactly these variants are more concerning, where they're making sort of the biggest headway and are chiefly responsible for the collapse in health systems and what's been going on in many places. The exception to this is perhaps Argentina, which actually does have a pretty good system of genomic surveillance. So they've been able to set up a consortium whereby they can trace and they can pretty much sequence virus genomes, so they can have an idea at least of where particular variants are, especially the VOCs. But with the exception of Argentina, other countries in the region have not been very good at such type of surveillance, and therefore we are pretty much in the dark as to where exactly they are. But that having been said, in the case of Brazil specifically, we have seen some horrible scenes coming out of Manaus, coming out of other parts of northern Brazil, as well as southern Brazil, which is where now we suspect these VOCs are. They're all over the country, just to be clear, but they are affecting certain localities more than others. The fact that one of these VOCs appeared in Manaus is very telling. Manaus was a city that was very hard hit by the pandemic early on, and there were a lot of different there was a lot of research after the first, let's call it, wave of the pandemic in Manaus, looking into how many people actually caught the disease. So how many people showed antibodies. So in other words, what was the Ciro prevalence in Manaus of COVID, or people presenting neutralizing antibodies to COVID. And those numbers were very high. Those numbers were around 70%, according to some studies, even higher for the city of Manaus, meaning, you know, there was a very large chunk of the population that was infected. That led to a lot of speculation over herd immunity, that herd immunity had been attained in Manaus, and therefore, you know, things could reopen and life could go back to normal. But 8 months after that, this new variant showed up, and it basically led to a second complete collapse of the health system, this time much more dramatic. The hospital system ran out of oxygen, so there were people lying without oxygen. At the moment, there are people in several parts of the country that not only are hospital systems that not only do not have access to oxygen, they also don't have access to sedatives. So people who need to be intubated, which is a very complicated procedure and can be very painful, they're being tied in order to be intubated. It's a horrific, absolutely horrific situation, horrific scenes coming out of Brazil, but also coming out of other parts of Latin America. So these variants are in circulation. The vaccination campaigns are also proceeding at different speeds in different countries. So for some countries, they have advanced a little more. For other countries, they have advanced very little. Brazil, again, which is the country that I'm most knowledgeable of, the vaccination campaign is delayed. Brazil does not have, at the moment, sufficient doses to really jumpstart its vaccination campaign. This is a shame because it is a country that does have a public health system and has ample experience with mass vaccination campaigns. In fact, it's a country that's been looked upon by the rest of the world as an example when it comes to the institution of sanitary measures and vaccination campaigns and all of that, because of the public health system and its capillarity in the country. but the denialism on the part of the government has actually come in the way and has impeded these processes from actually taking place in the way that they should. So there aren't enough vaccines in Brazil. People are not getting the doses they need. And we are not sure when this situation is going to be resolved. It doesn't look like it's going to be resolved anytime soon. And this kind of plays out in other parts of Latin America as well. Smaller countries and countries that took action earlier, such as Chile, are faring better when it comes to vaccinations. Argentina is also faring better when it comes to vaccinations. It has a wider portfolio of vaccines. Brazil only has two. It has the CoronaVac vaccine from Sinovac, and it has the AstraZeneca vaccine. And it's not clear whether or not it's going to acquire more doses of these same vaccines or more vaccines, or what's going to happen. At some point, it will have the capacity to produce those vaccines itself, but the capacity is currently not there. Bottom line is that for the region as a whole, there is no chance of any kind of economic recovery without a broad vaccination effort. Vaccines are crucial to stopping the viral transmission channels, and they're also crucial for these economies to recover. Levels of inequality and poverty in the region are now sky high. As you all know, the region suffers massively from both very high inequality, very high poverty rates, very high levels of labor market informality. These are at historical highs. All of these indicators are at historical highs. And again, unless the public health issues are brought under control, there is really very little hope that the region will be able to recover and to start to mend some of these very big fissures that have shown up in society over the next few months, perhaps years. So I'll end there with my initial remarks. Thank you, Jim.
Thank you very much. Thank you very much, Dr. Bolle, and really thank you for those opening remarks. And I'm looking forward to the questions. I'm sure that they'll be flooding in here shortly. But let me go ahead and introduce Dr. Ciro Ugarte. Thank you again for agreeing to participate. And please, we'd love to hear your thoughts, opening thoughts on this issue.
Okay. Thank you, Jim. This is a great pleasure for me to join the panel. Really, this is an area where PAHO and I myself have been linked with many years. I was the Director General of National Defense Office at the Ministry of Health in Peru for 11 years, and I dealt with conflicts, terrorism, also large outbreaks, including cholera outbreak and many others. And we've learned during these years, and also looking at the experience of many other countries, responding, for example, to H1N1 in Mexico for the first 3 months. I was in charge of WHO and PAHO response, and also in Paraguay, urban yellow fever, and many other countries. But we've learned that the health security is linked with several areas. One is pandemics, of course, and COVID-19 is one of the experiences that we are dealing with. In many areas, like has been mentioned already on the variants, but also the high mortality and several other issues that I would like to also give some comments about. The large disasters that have an impact on many large populations and have a profound effect on the health of populations. I was also responding in charge of WHO's response after Hurricane Mitch in Central America. I was based in Honduras in '98. And we've seen that impact in large disasters. And lately, Hurricane Ida and Iota, particularly in Honduras, but also in other countries in Central America, have a profound effect during also COVID-19. There are also political crises in several countries. We can identify, for example, Venezuela, where the health aspects of health security aspects are paramount. As we speak, both parties, Maduro and Guaido, are meeting at PAHO country office this morning to discuss how to proceed on the vaccination of their population and how to link the priorities of the health sector and the health of the population and try to overcome the political turmoil that is currently happening in Venezuela and for many years. The other one is conflicts, internal conflicts, but also wars. As you may know, the Central American War, for example, had a huge impact on health, particularly on the immunization programs, polio and others. And but also health was the avenue, the bridge to bring those parts in that conflict together. And the health as a bridge for peace was established in Central America, and there are many publications around that. The other aspect is also bioterrorism. We've been dealing with this issue, even though it is the probability is low. But when it happens, it will have a profound, a big impact on the population. And the other one is migration. Migration not only in terms of bringing the disease from one country to another, that is actually mostly a myth rather than a reality. Okay, associating the travelers, international travelers, on the dissemination of certain diseases is actually not only a myth, it is clearly a problem for the migrants and also for the local populations. There is, of course, there is an impact, but the perception that that is the cause, it is clearly not aligned with what is the evidence. And there are many publications, including the Johns Hopkins University publication on migration and health, that I invite you to read and look at, because you will be surprised how many myths are around health security and migration and health, etc., that are simply not true. So going to the COVID-19 itself, there are some aspects that probably it is not widely known but by many people, but some aspects we do have contact with all the countries and have pretty good information on what is going on. And that is related with the genomic sequencing, for example. And I don't know if I can, if I'm be able to share a screen. I think I may.
Yes, go ahead. You can share your screen.
Okay, good. So, all right. So you see this. This is the web page of PAHO coronavirus pandemic, and you see this is the you scroll the page, and you'll see the last report of the Americas, but also you see here information on COVID-19 vaccines, and then you see to the right the genomic surveillance regional network. I will click on that, and you will see that there is a genomic surveillance regional network that has been built for many years. It is not new for COVID-19. It has been built through the influenza pandemic and other diseases. And we have a large network, a regional network of COVID-19 genomic surveillance, as I said, was built on other initiatives. And you see all the laboratories that are there. We do have two regional laboratories. One is Fiocruz in Brazil, and the other one is the National Institute of Public Health in Chile. And you see all the other laboratories. Many of them do have a genomic capacity on site, and several others are able to send the samples. And when we see this graphic, you see here the sequencing status, but also the countries that we have in-country capacity, and then the reference laboratories, as I mentioned. And you go down and you see how this information is being shared globally. And globally, the global information data on available information on influenza data, it's taking some time. You see, this is the system that is in place already. And this is the contribution of the Americas to the global network, to the GSAID. So there are, you see, there are 3,878 genomes collected between February 2020 and 21 that was shared on the global level. So there is a genomic capacity. Many countries are participating fully on this, and the variants are being identified in the countries. The issue is that once you associate certain variants with large mortality or other issues, then we began to have problems. And many countries will not, they want to be sure that the information and the message is passing well. And I would like also to share with you what is the situation around variants. Are you able to see the COVID situation in the North Amazon basin? Yes?
Yes, we can
Okay.
see the screen.
Very good. Thank you so much. Thank you for confirming. So this is the information that we collect on these three border areas, Brazil, Colombia, and Peru. And you see the population density and several others. And we have a dashboard. You know, you'll be familiar with this dashboard because you use a lot in the Johns Hopkins University. But you see, there is information that you can look at, and we try to maintain as accurate and as updated as we would like. The last update that was done here is on the February 21st. So this information on what is the cumulative number of cases per state, per area, and so on. And there are the countries themselves are responding to this challenge in the Amazon basin. And there are also contributions from Canada, the US, and others that are providing additional support. We've been able to mobilize experts from CDC at the request of CDC and Brazil, and they have been deployed to the northern Brazil to help us on the genomic sequencing, the epidemiologic data, and the analysis and investigation of variants and several others that will be beneficial for Brazil, but also for neighboring countries. And regarding vaccination, also in the page, in the page that I mentioned on the PAHO webpage on COVID-19, you will see information on vaccines. So this is the first page, well, coronavirus pandemic, and then you can go here, and there is the vaccines, and you'll see what is the status of the immunization, and also what is the landscape of the capacity of the countries, the readiness of the countries, vaccination introduction readiness tool that has been used by many countries, and you can click in the country and see what is the status of the country according to several monitoring framework, deploying vaccination in the region areas, for example, management, structure, advocacy, and resources, and several others. So you can see what is the status of the countries because they provide that information, and that information is needed for the countries to receive vaccines from the COVAX facility. So this is the information that you can look at, and also you can see what is the status of the vaccination strategies in the Americas, how many vaccines have been applied, how many people with one doses, with second doses in the region, and you can click in any given country, and you'll see, for example, that in Argentina, as of 19th February, 668,000 doses have been applied. So there is enough information on this, but I invite you to look at those, but also to highlight that this is an issue. Health security cannot be separated from other areas of the work of the countries, particularly the security areas. And when I mention security areas, it's not just the let's say the armed forces or the police. It is mainly the security network that is in the countries, including the foreign affairs ministries and all the areas inside the laboratories that will be able to detect some problems, I mean, infectious hazards on time. And it is linked with another global regulation. It is the international health regulations. And we are discussing the international health regulations on how we can build a safer world. And this has been elusive for us for many years. Even though in 2005, the international health regulations, the current version of the international health regulations were adopted and being implemented since 2007, there are many holes. The main hole is what will be the consequences for the state parties or the Secretariat of the International Health Regulations, that is WHO, if we do not comply with the regulations. So this is a big hole, and this is a discussion that now is trying to be filled by review committees, independent panels, other advisory and supervisory groups, and yet alone the member states now are discussing on establishing a working group to look at how WHO meaning the Secretariat and the member states, can strengthen the work on health emergencies and health security, but this is far from being solved. And in my opinion, maybe some of you have heard from me, there is a need to approve one resolution at the World Health Assembly, and probably also another law inside the countries regarding health security that will, with one line, comply with all approved resolutions. Nothing else, and we will save her. Over, thank you.
No, Dr. Ugarte, thank you very much for that. And so I already have a couple of questions, both in my mind, but some that have already been directly asked. And so, you know, I'm going to kind of bounce the questions between different panelists. The first question that I did receive in the Q&A chat is from Gustavo Ramirez. And, you know, he asked, I'm going to do the quick interpretation, but do you think that the purchase of vaccine by Mexico was transparent? It was the correct purchase. So that's kind of the first one. But then also, you know, if you want to opine, and this is really for Dr. Ugarte, can you opine on whether, you know, Mexico's call to the UN denouncing wealthy nations' so-called hoarding of vaccines is going to have any effect in the region overall, maybe getting vaccines on a quicker basis?
Thank you for that question, because that is happening also in many other countries. Establishing COVAX was a way out, and also to apply a lesson learned from previous large pandemics, particularly H1N1 2009. The vaccine was available for the countries, for the low and middle income countries, 1 year or 2 years after the high income countries had access to that vaccine. So because of that, and looking at how can we improve that distribution, equitable distribution, the COVAX mechanism was established. But one thing is establishing the mechanism, and the other one is respond to the expectations of the member states and the population. This is another issue. COVAX facility was established to provide up to 20% of the population's coverage with the doses during 2021. During 2021, not in the first months of 2021. And it was clear from the beginning that the vaccines may be available in the first quarter, second quarter, and then more vaccines in the third and fourth quarter. And as I said, one thing is the expectation, and the other one is the ability of the system to provide those vaccines. And yes, still, high-income countries, and also some of those countries that began their discussions on a bilateral basis, have been successful in having a large proportion of vaccines. As the Director General of WHO, but also PAHO's director mentioned yesterday at the press conference, the Americas are not having, I mean, except the US, only except the US, the rest of Latin America is not receiving a fair share of the availability of vaccines. And many of our countries have been affected heavily by the pandemic. And even in the distribution, in the allocation of vaccines from the COVAX facility, we are receiving a small share of those vaccines. So it is just understandable, but that any country, including Mexico, Chile, Argentina, Venezuela, Honduras, El Salvador, and many others, will reach the manufacturers directly and have those manufacturers selling them the vaccine at the price of the vaccine, the time of the shipment, but also the availability of those vaccines are also impacting COVAX, because COVAX is a pool. If you go outside, of course, the manufacturer will sell you those vaccines directly, especially if you allow them to, for example, certain clauses of confidentiality and also liability and some others that the countries will say, okay, I need that now, and no matter what, I will pay whatever it is, and I will sign whatever it is, and I will receive the vaccines, even though those vaccines were not properly assessed and included in WHO universal or emergency listing. Why? Because that process is complex and it follows a strict regulations. And you know that only 3 vaccines have been included in the listing as we speak. Pfizer, AstraZeneca from Korea, and AstraZeneca from India. Moderna and several others are online. But unless we receive all the proper documentation and the technical teams visit the manufacturer sites, WHO will not be able to include those vaccines into the listing. Meanwhile, the countries are authorizing the application of those vaccines in their own countries through their national regulatory authority.
I know, thank you, Dr. Ugarte, and the questions are coming in, but I'm going to switch a little bit and ask Dr. Bolle to answer this question. And I apologize if I'm not going in order here, but I just want to keep the flow correctly here. So, you know, Mariana Nascimento Plum, she writes, Monica, you said the Brazilian vaccine plan is failing. Still, the country is ranked in the 17th position in vaccine doses administered per 100 people. The better performance between BRICS countries and the second better performance in Latin America in total dosages administered. Brazil is ranked in 8th position. We're seeing many European countries dealing with the absence of vaccines and delays in the delivery of doses, considering the size of the country, the vast population, and that still they have only 2 vaccines available, but advanced in the capacity to manufacture our own vaccines. Can we affirm that Brazil's vaccination plan is failing? And so please share your thoughts, Dr. Bolle.
Thank you, and thanks for that question. I did not say it was failing. I said it was very delayed, and much so, actually. The reason why we can say that, even though we do know that there are problems in the rest of the world, we've seen problems in Europe, we have even seen problems in Germany, where we did not expect to see problems. We have seen problems with vaccine rollout in the US, and we can name a lot of other places where that has been the case. However, here's the thing. Brazil is a country that has a tradition, a sanitary tradition that goes back to the late 19th century and early 20th century. So if you look at the most renowned medical sanitarists in the world, there are at least 2 of them who are Brazilian. And they have institutes named after them. One is the Fundação Oswaldo Cruz, Fiocruz, which Dr. Ugarte mentioned here. And the other one is Adolfo Lutz, and there are many others. So Brazil has a history, actually, a very rich history of dealing with infectious diseases, of knowing how to address these problems, because of course it is a country that has faced many bouts of infectious diseases in its history. It is a country that fared relatively well during the Spanish flu. So there's a rich history on how the Spanish flu played out in Latin America. And the history and how it played out in Brazil was actually much better than it did in other places, precisely because of this sanitary knowledge. Now, if you move on a few years, or actually a few decades, Brazil, after the 1988 Constitution and after, you know, it got rid of its military dictatorship, Brazil instituted or started to institute the SUS. The SUS is the public health system, the Sistema Único de Saúde. And the SUS is probably the only national public health system with full coverage, offering full coverage in an emerging market. And the way it was set up, the way the SUS was set up, it was set up to emulate in part the NHS, so the UK's NHS. The SUS, the system is actually, SUS is actually a miracle, because having been able to set up such a system in a country that, you know, had so many financial crises in its history, so many economic problems, is really a feat. And Brazil was able to do this and create this wonderful system. And it's a system that has really been studied, researched, and tried, and many other countries have tried to emulate it, because the continental size of Brazil and the fact that this system is able to cover, yes, with some heterogeneity, of course, but the fact that it is able to cover the entire country is really something. The SUS is responsible for all vaccines and everything related to infectious diseases. So the other health institutions or health agencies, Instituto Butantan, which is currently developing the Coronavac vaccine, Fiocruz, which is currently working with AstraZeneca to develop and produce that vaccine in the country. These are all parts of the SUS. Anvisa, which is the sanitary agency and supervisory agency in Brazil, has world status in terms of global status, in terms of the way that it's viewed. And it is a very, very serious agency with extremely competent people working for it. So it's a system that would, in other times and under a different government, have been able to deliver and actually run a mass vaccination campaign that probably no other country could emulate to the extent that the Brazilian system could. And I'm not saying this just because I'm a Brazilian national. I'm saying it because it's the reality. The SUS vaccinates on a massive scale a lot of people, the largest chunk of the Brazilian population every year, with its flu campaigns. Every other vaccine, every childhood vaccine, or vaccines for yellow fever, or anything else, you name it, it's the SUS that runs it. So it is a really very impressive system. It is by no means, in that sense, comparable to even the US, where such a system does not exist. So Brazil could, if it had a different type of government in place, have had, at this point, a vaccination campaign that was much more advanced than other vaccination campaigns in the rest of the world. There's a massive waste of opportunity here. And the reason why that opportunity is being wasted is because there is a government in place that denies the need for vaccines. They did this in the beginning. Now they recognize that vaccines are needed, but there's a lot of politicization and ideological viewpoints coming into the vaccination strategy. So for instance, Coronavac, which is one of the 2 vaccines available in Brazil, is still called by Bolsonaro and the Bolsonaristas the Chinese vaccine, giving it sort of a pejorative slant. And that, of course, is driving vaccination coverage in Brazil and vaccine hesitancy. Brazil is a country that has a history of not having really a very meaningful anti-vaxxer movement because of the perception of how useful and how important the SUS is, the public health system is. And it's a country that has seen under Bolsonaro a massive decline in people who are inclined to be vaccinated. That is a result of policy. That is not a result of the system. So when I say that the Brazilian vaccination strategy is delayed, I have that context and that history in mind.
No, thank you very much, Dr. Bolle. And so now, I think there are a lot of questions coming on specifically about vaccines in different countries. And so, let me ask one more kind of regarding vaccines and the distribution. There's one from Roberto Galvez, who asked, when do you expect the COVAX to arrive in Peru? And so that's the specific question. But I'm going to open that up a little broader. I mean, you can try to answer that, but I think the broader issue, and I think, Dr. Bolle talks about it. Hey, Brazil should be leading the charge, not just regionally, but globally on vaccination passed on their past. But I think there's also, we talk about inequality, and there is a large difference between Brazil and some of the poorer nations in Central America. And so, the question was specific about, Peru, and if you can maybe address that, but what hopes do countries in Central America have in ever getting the vaccine from your perspective? So please share your thoughts.
Thank you. Well, that is also the question that would like COVAX to answer, okay? But according to the informal discussions that we had with WHO, because there is a need to clarify what is COVAX. COVAX is a coalition between Gavi, the Global Alliance for Vaccines, also CEPI, that is the innovation for the development of vaccines, and the other one, or preparedness initiative, and the other one is WHO. So there is a group, that is a decision group that is composed by external experts and appointed that there's a group that will assess and say, okay, in our opinion, this is the allocation of vaccines that you should give to the countries. And they identify which are the criteria. COVAX, in the initial phase, when Pfizer donated 2 million doses, or 1 million doses, 1 million in advance, say, okay, from these 1 million doses, we will distribute among all the regions according to the mortality rate in the last month, the highest. So they announced that. Okay, those vaccines are yet to arrive to the countries, even though that decision was taken several weeks ago. And the first shipment of the COVAX facility is expected to begin next week to many countries. And by end of March, all the participant countries of COVAX will receive a certain number of vaccines, all countries. So if Peru is asking when COVAX vaccine will arrive, the latest will be at the end of March. But there is a big condition on this. The countries must comply with several situations: legislation, importation, liability clauses, and the readiness to apply the vaccine. If the countries do not comply with those clauses and requisites, even though the country, and also the payments, okay? If the countries do not comply with that, may not receive the vaccines. So we have a variation among the countries in the Americas that not all participants are willing to sign a liability clause that will release the manufacturers for the liability of the vaccines that they produce and transfer those to another mechanism, okay? It is actually a protection for the countries as well, but it is an issue of, if you receive the vaccine and there is an effect on you as a person, you have the right to comply to the institution that applied you the vaccine, and then at large to the manufacturer of the vaccine. Well, that is the liabilities, cutting that right and moving that to a fund. So, and you will not go against the government or against the company. But you have to think deeply on that one, okay? But that's one of the requisites. The other one is that the national regulatory authority will approve the arrival of those vaccines, and the customs will also ensure that those vaccines will arrive and will be released from customs. And it's excellent when we've heard on Anvisa in Brazil, because this is one of the most important and strict regulatory authorities in the world. And I recall during H1N1, we sent antivirals. And also during other large outbreaks, we sent vaccines to Brazil. And those were at the customs area for months, okay? Because the National Regulatory Authority, that is the ultimate protection for the people, takes that seriously and will not allow those medicines and supplies enter the country unless they comply with the national regulation. And the population may say, come on, we need those, but then who is ultimately responsible is the National Regulatory Authority. And it happens with the US and others. So those are the type of aspects that need to be also ensured before the vaccine from COVAX or from any other source will come. But all those issues that I'm mentioning are moved apart, are wiped out when there is a political decision to bring vaccines into the country. And even those vaccines that are not included in WHO's regulatory global listing, emergency listing, and not approved from other strict regulatory authorities are entering our countries and are being applied to the people. So those are the type of issues that I would like to highlight, because this is the reality. And this is the reality that will happen for the rest of the year, because the availability of proven vaccines, let's say authorized vaccines, will be long, and it will not be available at the rate that we would like until 2022.
No, thank
We
you.
hope it is not, but that is what the forecast that we have now.
No, thank you, Dr. Ugarte. And that actually leads me to additional questions about the different types of vaccines. But I'm not going to ask that right now. I'll get to that here in a second. I know a lot of people are interested in that. But I kind of want to transition and ask Dr. Bolle a specific question from Paul Thompson, who put it in the Q&A chat window, which is really, what would your policy recommendations for the U.S. government with respect to the COVID response to Latin America be? How would you recommend that the U.S. change its policy, maybe use this pandemic as an opportunity to increase its influence maybe in the region, or what are your recommendations for U.S. policy given this?
So that's a really good question, and I'm going to piggyback on Dr. Ugarte's remarks, because I share all of them and I share all of his concerns, and use those as a platform to answer that question. Because at the moment, the most important issue in the world, including for geopolitics, is vaccines. So when we think about vaccines, we're talking about diplomacy, we are talking about geopolitics, we are talking about international relations. So we're here at SAIS discussing medical issues from a geopolitical and from an international cooperation perspective. And there, vaccines are key, and what you do with them is key. The lack of vaccines and doses that currently prevail in Latin America are very much, well, they're a result of many factors. Of course, they're a result of lack of planning by many countries who should have foreseen their needs and should have advanced, orders and other things to facilitate the distribution and the arrival of these doses in their countries. They didn't. It's Latin America, as you all know. It takes a while for Latin America to get its act together, always has, always will. That is the hallmark of the region. So that certainly was a factor. But there's a second factor that is largely affecting the emerging, developing, if we can still use that term, or poorer countries, which I think is a better way to say it, which is real. Rich countries, by and large, have pretty much dominated or hoarded, and the numbers are available, many of the vaccines that are available. So if you look at a country like, for instance, Canada, Canada has enough dosages to basically vaccinate their populations 10 times over. The US, even though the vaccine rollout has been slow, has also secured enough doses, more than enough doses, I should say, for the US population. So because vaccines are so central in this discussion, are so central to geopolitical and diplomatic relations, it will be, at this point, you know, politically, it's difficult to make that case. But at some point, it would be very helpful if the US and the current US administration gave some attention to its backyard, which is Latin America, and looked at the issues, the pandemic issues and the uncontrolled epidemics that are raging in much of the region, the lack of vaccines and the lack of doses, and provided these countries to some extent with the extra doses that they will have available of vaccines that have actually gone through the entire process of proper evaluation, scientific evaluation of the data that came out of the phase 3 clinical trials, which is where, you know, my comments come in, sharing Dr. Ugarte's concern. There are many vaccines in the region at the moment which have not received the proper scrutiny from sanitary agencies in these countries, or even outside of these countries. One such example, just to name one, is the Covaxin vaccine, which is being produced in India and is being bought by several governments in the region. The government in Brazil is currently negotiating a contract to buy Covaxin. There is a lot of political pressure on Anvisa to expedite the process of emergency approval for Covaxin. But Covaxin has actually not even cleared the phase 3 clinical trials in India. So this is a problem. This is a big problem. And this is a concern. This is a health concern because we do not know the safety or the efficacy of these vaccines unless we have the data from these clinical trials. And that's just the beginning, because the whole process that goes into the approval of a vaccine for use, where the vaccines are produced have to be inspected. Whether they're being produced with safety has to be inspected. There's so many levels of inspection that go through this process of authorizing the use of a vaccine. And we saw that recently. Anvisa did an open meeting in the approval process for AstraZeneca and CoronaVac. They had a 9-hour meeting, which was televised for the entire country, so that everybody understood what the processes were that they were looking at to approve these vaccines. So people had a real sense of, you know, the fact that it is not just, oh, we have a vaccine, let's go ahead and use it. And that was really something. And I think it was really helpful to allow the population to understand that. That was in Brazil. But of course, you know, everybody is anxious for a vaccine. Governments are anxious to say that they have vaccines for political gain. And therefore, you know, some are moving to politically pressure these agencies, which is very bad. Here's where the US can come in, because with its extra doses, at some point, once it has rolled out sufficient vaccines in the US, it really has to engage with the region in the provision of other vaccines that could help further diversify the vaccine portfolios that are available. But not only that, the dosages. Because one thing that we have already seen in some countries is that vaccination campaigns are delayed because they don't have sufficient doses. So I will give you an anecdotal example. My mother was due to get the CoronaVac vaccine 3 weeks ago. She's over 75, so she's in the group that is currently prioritized for receiving vaccines. She was not able to get her first shot yet because the CoronaVac doses are just not available. Rio, the state of Rio and the city of Rio ran out of the doses, so they had to interrupt the vaccination campaign. So these are the sorts of issues that that Latin America is facing, and the US can be immensely helpful. And if it is, you know, given that geopolitics and diplomacy run through vaccines, it can really establish extremely good relations with a lot of the governments in the region.
No, thanks, thanks, Dr. Bolle. And you know, I was really interested in you talking a little bit about the different vaccines and which have actually gone through phase 3 clinical trials. And there is a specific question for Dr. Ugarte from Alejandra Sanabria, which is what is your opinion of AstraZeneca? And it's very specific on that vaccine, but you know, maybe open that up and what's your opinion on different vaccines, you know, and you know, should the region be a little more concerned about, you know, vaccines that made it through phase 3 clinical trials, and should they be concerned with some of the different vaccines coming from Russia, China versus those from the US? So, you know, maybe give your opinion on the different portfolios of the vaccines and maybe something, you know, a lesson on what the region should be taking into consideration as they try to get more vaccines.
Thank you for the question. It goes to the principles on how PAHO and WHO consider the development of the vaccines and the process to advise the countries on which vaccines we consider that comply with all the regulations. That is a recommendation. We do not approve vaccines, okay? It is a process where the national authorities approve or not approve the vaccine. So in that regard, there are many vaccines that are on the table and are in different phases of development. And also, when we are able to look at the documentation and then have the panel of experts analyzing that documentation, and then back and forth with the researchers in each of the countries where the clinical trials are being, or the level of vaccine trials are being done. And then we ultimately, the last step is to go to the manufacturer facilities and see directly what is the process, and also analyzing those vaccines to see if they comply with what they say it contains. So this is a long process. So we cannot approve and we cannot discard any vaccine. Okay, that is the principle. Why? Because there is not evidence to say the Russian or the Oxford or the India vaccine is not, or the Cuban vaccine is not useful. We do not have that information. We are working in most of the countries as a WHO, as PAHO, with all those countries in order to support their systems and their research, because it is on the benefit of everybody to know if a vaccine is effective or not effective. As of to now, according to the vaccine trials, most of the vaccines have a huge effect on preventing deaths from COVID-19. The other efficacy, that is usually the ones that we compare, it is how many of those will prevent me from developing symptoms from a COVID-19, let's say, contamination or infection. That is a different factor. Yes, you may develop symptoms, mild or moderate or severe, but in most of the vaccines, as we've seen, prevent the deaths. So I'm going to go to that point. Why? Because at the first stages of allocating vaccines to all the countries, it is to save the lives of the people at higher risk of dying because of the vaccine, because of COVID-19. And this is an issue that it is related with protection of the people that are above 65, 75, according to the countries, but also the healthcare workers. And we are promoting that the countries that do have vaccines share those vaccines with other countries, because that is the solidarity that they must show. And we have examples in our region. Some of the countries in the Caribbean, Barbados, Dominica, received donation of vaccines from India. And they share those vaccines with other countries, even though they know that those will not be enough. you know, looking at those type of solidarities, but also looking in other avenues, like President of Colombia, for example, saying, okay, I have huge problems to vaccinate all the migrants because I don't have enough vaccines for my own population. But the decision of the government is to include the migrants also in the healthcare access. That is a bold decision. But then you have to see, okay, if that, does that help to the control of the pandemic? A big yes, a big yes. And just a clarification on some of the countries that apparently have more vaccines than the entire population, like Canada, Chile, and many other countries. They made the negotiations and they are looking to purchase, even some of them have put the purchase order, but they do not have the vaccines yet. Canada does not have enough vaccines to vaccinate their priority groups yet. So they are not available inside Canada, okay? And the US does not have enough vaccines also. So those are type of issues. And yes, I think the US, by providing $2 billion to COVAX facility, it will go everywhere. But then the countries that will receive benefits from that contribution will know, okay, this contribution is coming from. Some other countries are taking another avenue, are donating directly to certain countries. And the countries and the population and the international community know that it is India, it is Russia, it is Israel, it is this other country that are helping us. It is just to think about what is the change of vision on international solidarity, but also on international cooperation on vaccines. Thank you, Jim.
No, thank you. And that's a really interesting point. You know, going directly to the countries from one country to country it is a good job at elevating the reputation of that country in the eyes of that recipient country itself versus going through kind of multilateral system, which maybe is better in the long run, but does maybe to some degree lessen kind of the information campaign of the country that's donating the vaccine.
Although Jim, Canada, for example, donated a lot of personal protective equipment through PAHO to the countries. But when the countries received those personal protective equipment through PAHO, there was a sign and also from the US and others say, this is a donation from the people and the government of Canada. So that's another avenue. It's through multilateral, but it is directly to certain countries that the donors will like to focus on, okay?
No, thank you. No, and I appreciate that. And, you know, and one question, and I'm going to kind of remodel Gina Nieto's question. It talks a little bit about, you know, the veracity of the data. And you talked a little bit about before, especially with the rollout of vaccines into the region for multilaterals, a lot of it is based on the reporting. But would that not then create an incentive for maybe false reporting from certain countries to make it seem that the situation is worse, or maybe the information is inaccurate and countries that should be receiving it are not reporting correctly and therefore might be, you know, negatively impacted because their reporting isn't accurate, yet they probably need it more importantly, or they need it with more priority. And so, you know, this is a question, I'll first ask Dr. de Bolle to answer that, and then Dr. Ugarte, you know, because the data collection is a key, you know, key element in the distribution of vaccines worldwide.
Yeah, absolutely. I think Dr. Ugarte can probably speak to this better than I can. But, you know, in the region, the chief concern is, because of course this is the remit of the sanitary agencies, right? The Anvisas of Latin America, the many different sanitary agencies in different countries. And of course there's different capacity in different countries to do that kind of proper monitoring, which actually goes beyond, you know, sort of making sure or ensuring that the doses, the specific doses that are being received are actual vaccine doses as opposed to something else. But it goes also into the monitoring of the distribution, the whole logistical effort, right? So the distribution of the vaccines, how you do it, where it gets to, and once it gets to a particular place, whether it's being used correctly, because of course, you know, what's happening is that for a lot of these vaccines, you have many doses in a vial. And once you open a vial, you can use it up to a few hours sometimes. It's not even a day. And so one thing that needs to be ensured, particularly in countries, well, all of them, which don't have sufficient doses, is that we're not throwing away, you know, this major asset for getting countries back on track. That, you know, vaccines are not being thrown out because the vials are not being fully used. That's an issue. The other issue is, you know, do you have enough people distributed across countries that can actually vaccinate other people? Do they know how to vaccinate? I mean, not that it's, you know, rocket science. These vaccines are all intramuscular, but nonetheless, you know, there have been reports in the region where people have not received the vaccine properly. And therefore, you know, there's a question as to whether or not they're protected. And so there are so many issues when you're talking about these mass vaccination campaigns, and you think about, you know, all the different levels of monitoring and supervision that you need to have. It's mind-boggling, and they're huge. You know, they're massive. And as I was saying before, when I emphasized Brazil's experience, the thing with a country like Brazil is that because it has done this so many times, it does actually have the practical experience on the ground to do this sort of supervisory and monitoring work from the actual, you know, dose of the vaccine. Is it really a true dose of the vaccine? To, you know, are you correctly using and storing the vial from which you use the doses and everything else that goes in between? Are you storing it correctly? Are you storing it at the right temperature? Do these different places where you're allocating vaccines to, do they have the refrigerators to store the vaccines? You know, all of these issues are major, and different countries face different challenges in that regard.
No, thanks, Dr. Bolle. And Dr. Ugarte, your thoughts on the reporting and the importance of that and some of the insights.
Most of the countries do have a system to monitor the vaccination and the application of doses, mostly. The other part on the protection is another avenue, okay, that we can talk later. But on the vaccination rollout, most of the countries do have accurate information. And but the monitoring of those, of the application is not that easy. Why? Because the priority groups are established in the national plans, but there are certain vaccines to go somewhere else and not necessarily public. And sometimes when it became public, okay, it means the resignation of the authorities or the people who receive those vaccines, not following the proper line of priority, okay? We have many examples in the region. So there is enough information, but the most important information that we are working with the countries is to look for the adverse events of the vaccines, the potential adverse events. Why? Because we need to identify them early, to investigate and do research, to have a proper investigation of the adverse events, and then eventually make the decision to stop the vaccination or continue the vaccination, because it's a life-saving vaccination for the people at higher risk. So there is enough information, and the other component of the question is the communication to the public. The communication to the public, in my opinion, is as important as the actions the governments and the institutions do. If you are doing a lot and then you're benefiting a lot of people, and then you communicate poorly because of transparency, because of concern of the information, accuracy of information, etc., you lose the battle with the public, and then you have all these problems with the control of the pandemic. And I think that is the part that we are not paying enough attention yet. And then we have all these opinions through social media or other avenues that are so deep into the minds and the actions of the people that are not aligned with science, with evidence, but are not aligned either with the control of the pandemic, and it's causing more harm than the benefit that the governments and the institutions, public and private, are providing to the people.
No, thank you, Dr. Ugarte. And just one quick last question for both of you that I kind of just want to ask. Just give me your thoughts, not, because we're already at time, but, what I wanted to ask, there are some countries internationally that are already kind of directly talking, as you mentioned before, Dr. Ugarte, obviously China being one of them, but even somewhere I read Israel and is donating vaccines, I think to Honduras and a couple other countries. And so just from that perspective, who do you think are the countries that are best leveraged right now to be able to give vaccines and also are really taking advantage of this to bolster their image in Latin America? Just a couple countries right off the top of your head who you think. First, I'll start with you, Dr. Bolle, and then Dr. Ugarte.
Well, China, definitely. We have already seen how, different Chinese or laboratories from China have not only provided vaccines to the region, but actually run clinical trials across different parts of the region. So China for sure. And then I would say Russia. Well, of course, AstraZeneca, but I would say Russia, because a lot of countries have either bought Sputnik Vac or are using Sputnik Vac. By the way, it's Sputnik Vac. Everybody calls it Sputnik 5 or Sputnik V. It's not, it's Sputnik Vac, the name of the Russian vaccine. These two vaccines are different. So CoronaVac is an inactive virus vaccine, so it's sort of like the same platform that we use for the flu. But the Sputnik Vac vaccine is a viral vector vaccine given in 2 doses. So it's sort of like other viral vector vaccines, but not exactly, because the viral vectors used are not the same. So the AstraZeneca vaccine, which is also a viral vector vaccine, uses a viral vector that is actually not even a human viral vector. It's a chimpanzee adenovirus. And they had their reasons for doing it that way. The Sputnik Vac does use human adenoviruses, but 2 different ones in the 2 doses for reasons also that have to do with suscitating the immune response that they want to suscitate. So I would say at this point that, we have across the region a supply of AstraZeneca, a supply of various Chinese vaccines, all of them being inactivated virus vaccines, and the Sputnik Vac, and now also in some places Covaxin. Covaxin is also the one from India. That is also an inactive virus vaccine. Chile has Pfizer. It's a genetic vaccine, so it's a messenger RNA vaccine. It's one of the only countries in Latin America that has secured the Pfizer vaccine. Other countries haven't. And yeah, so that's the general overview of which countries, which vaccines, and how each country has, what each country has in terms of vaccine portfolios.
Thank you, Dr. Bolle. And then, Dr. Ugarte, which countries do you think are best posed internationally to take advantage of this within the region?
I will follow what Monica said, because it is from the side of the manufacturers. And when we talk about countries, but it's actually manufacturers. Some of them are state manufacturers, but still they are manufacturers. And then what is the availability of those vaccines to be sent and distributed? We cannot tell about the vaccines that are not listed in the emergency list of WHO. But yes, there are availability of vaccines in several high-income countries that in my opinion, and also in the opinion of our director of PAHO, should be shared with other countries that do not have vaccine to protect their healthcare workers and the people at high risk. We are not talking about large number of vaccines, but we are talking about a symbolic number of vaccines that will make a difference. And I think that is the avenue that we'll need to follow. that type of solidarity that was the reason why many institutions that were established in the Americas, including PAHO, it is the one that should be followed by the countries that do have availability of those vaccines. If they receive a certain amount of vaccines and they know that their healthcare workers are readily protected, let's see other countries, because we know that which are the ones that are at the front line and also which are the people that are at higher risk. So I think that is the thing. So when we see those countries, I clearly see US, Canada, on that endeavor, and eventually Brazil, that if Brazil increase their production, etc., Brazil has been also a source of many vaccines for the region. And outside the region, the countries that were mentioned, and in my opinion, India is also another country that, according to our revolving fund for vaccines, is one of the regulatory agencies that have a strict analysis of their products, and we have a direct relation in terms of purchasing vaccines from India. But that is just a comment. But every country, every manufacturer that is producing vaccine and can assure that they are safer to the people, maybe the avenue to share those vaccines.
No, thank you, Dr. Ugarte, and thank you for contributing your time. I know we went 8 minutes over the original time, but really, Dr. Bolle, Dr. Ugarte, thank you very much for taking the time out of your day to share with us your thoughts on the pandemic and overall regional health security. It's an important matter for us, but I really thank you. I mean, this has really been for me, very a good experience to learn a lot from your expertise, and I'm sure same thoughts from all of the audience. So thank you very much, and that concludes our panel. And we're going to take a lunch break now, and then return at 12:15 for our third panel, which is titled "Far Away and So Close: Regional Dynamics and the Great Power Competition." So again, thank you very much, Dr. Ugarte and Dr. Bolle, and hope to continue in another opportunity the same discussion.
Thank you
Thank
very
you, Jim.
much.
Thank you, Monica. Take care.
Thank you.
Bye.
Take care.
Bye.